Hi, I just thought I would start to sort of go through the consultation slides so that we can, obviously, because you're not normally having a normal theory lesson, so I thought this might actually help, obviously, just talk through them if you wish. You don't need to listen to me. If you don't want to, you can mute me or just watch the other ones. So, consultation for hair services. So what is a consultation and what services require one? What do you all think? Is it just for the cutting? Is it just for colouring? Is it just for perming? Or is it every single service requires one? So basically, what services require one? It would be every single service, no matter if it's just a shampoo, if they just come in to have their hair washed, or whether it's a cut, or whether it's a colour, or whether it's a perm. It would be any service at all. And what is a consultation? So this is a use of questioning techniques to find out what the client requires. You're going to use your open and closed questions. So your open questions would be that you need to make sure you require an answer, okay? It's more of a fuller answer. Your closed questions would be just yes or no. After all that, once you've discussed what your actual client's needs are and you've really understood, you're going to feed back to the client their requirements. So that is obviously talking through exactly what you're going to be doing step by step. Okay, if the client agrees, you know you're both on the same wavelength. Contraindications. So this is anything that would stop a service or anything that would limit the service. So that could be if someone maybe has a bit of psoriasis, you maybe want to go a bit more gentle around that area. If someone's got male pattern baldness, it could be that you sort of like have to make sure that the hair maybe covers that. If someone's got alopecia, it might be that they want the hair covering it, so you need to make sure you leave that area slightly longer, or things like that. So it's things that could adapt. If anything, if they look like they have a full-on infection, you need to ensure that you refer them. Okay, we are not doctors, we are not pharmacists. You wouldn't tell them, oh, I think you have this. You would refer them to either their GP or pharmacist. Your client record card, you'd make sure you write all of this down, okay, no matter what. If you need to get in the habit of writing it all down, because then obviously if there is any comeback, you've got that to refer back to. Also, technical, so colouring, perming services, you need to write this all down. Make sure you sort of go through exactly what you've done. Client recommendations and advice. So if someone comes in with a picture and you really don't think that would suit them or their hair wouldn't go that way, you need to be honest with that client and turn around and sort of say, actually, it's not going to work doing that, but this may. So you're going to advise them, okay? You know, do recommendations. You know, if they show a picture and it's a very styled, very polished look, have they got time in the mornings to actually sort of style the hair, use all the products? So you need to be recommending all of that to them. Okay, so when we talk about visual aids can be your phone, can be a style book. We're not that we've got style books at the moment because of COVID, but obviously it's all things that are visual. So it's anything from shade charts, your phone, pictures, products. They are your visual aids. We will expect you to sort of use them, okay, throughout. And obviously professional behaviour. So it is talking in terminologies that the clients actually understand. Try not to sort of bamboozle them with lots of different wording. You know, so if I'm talking about someone who wants a short back and sides, I wouldn't be sort of saying, oh, we're going to do a short graduation today with a 45-degree angle going into a 90. Okay, that would confuse the client. So, client record cards, obviously they're protected under the GDPR, our Data Protection Act. And then you've got client confidentiality. Do not share any information that is on those record cards with anybody outside of your workplace. You're going to keep them locked up and secure. Record all chemical services, treatments, adverse and stroke positive reactions. So that's when we're talking about the hair tests, anything like that, that you are going to be sort of writing down in contraindications. Because if you've referred them to a GP and then the following week they come in with someone else and they haven't noticed, they might not have got it treated. So at least that other stylist is aware. Obviously now we put name, address and telephone number on it. Obviously more so now we're using email and even date of birth. We could use these for sort of promotions, you know, all things like that. So if you think, oh, we've got quiet month coming up, you could pop out like maybe a sort of like 20% off, or colour treatments or perm treatments. You know, birthdays, you can sort of like send out a happy birthday, here's 10% off. So you can use them for promotion. So contraindications, go through the worksheet. So I'm not I would have uploaded a worksheet. What I want you to do is go through. So you do normally need to sort of ensure that you've covered sort of 2 infestations. And there's a couple of infections on there, so infectious and non-infectious. Okay, but this is something that you just need to be aware of. Make yourself familiar. It's not a very nice one, but obviously some that are non-infectious we can adapt. But obviously if there is an infection or anything, we need to make sure that we do refer them. So during your practical sessions so far, we've discussed hair tests. Okay, so these would be used obviously following manufacturer's instructions, salon guidelines before, during and after a service. So your elasticity test is to sort of test the strength of the hair, the internal strength, okay, the resistance to breaking. So this is when you're sort of dampening the hair down and you're going to pull slightly. And you want to make sure it goes back to its normal state. Porosity test, this is how well it absorbs moisture. This is where we run our hands down the cuticle and we are sort of seeing if the cuticles are open, if it's rough. The skin test, this is when you're going to sort of ensure that they're not allergic to any of the chemicals within a colour. Again, you're going to follow manufacturer's instructions. Some say 24 hours prior, some will say 48 hours prior. You just need to ensure that you've read those manufacturer's instructions. Pre-perm test curl. So this is where you're going to take a cutting of the hair and you're going to wrap it around the perm rod. You're going to then use perm solution and sort of actually carry out a perm on this one little strand. Incompatibility test. This is when you're testing for metallic salts. So things like natural henna that you'd use on the hair, colouring wise, that there would react. What you're using is 20 mils of liquid peroxide, of 20 ml liquid peroxide with a couple drops of ammonia or perm solution in this. The reaction you're looking for is either it will get warm, bubbly, and it will fizz, okay? But you're just sort of looking for some sort of reaction. If that does happen, you will not be able to carry out anything, okay? So there'll be no perming, no colouring, because there is metallic salts in it and that would react. Your development test curl, so this is when the perm is actually on and you're going to sort of part way through, you're going to test the actual, see how it's developing, test the curl. So you're going to unwind a couple one perm rod at a time, but obviously just do a couple in different areas. The crown is quite resistant, so that'll be one area. You're going to unwind it 1.5 times. You're going to sort of like roll it back on itself, and we call that, we're checking for the S-bend. Test cutting, this is obviously where we're going to take a little hair piece, cut the hair off, and you're going to put it in the colour that you wish to sort of do the client's hair. This is obviously checking suitability of colour and to obviously see what sort of colour it actually goes. The strand test is to check the development of your colour or lightener while it's on the hair. So you sort of think, okay, the colour's got to be on for 35 minutes. You're still going to check that colour halfway through, okay, at certain points, just to make sure it hasn't turned a different colour or if there's like a reaction, anything like that. So we've got the 3 layers of the hair. So here we've got the cuticle, which is the outside, the cortex and the medulla. Okay, so the medulla is the very center, your cortex is the little like liney bit, And then you've got the cortex on the cuticle, sorry, on the outside.